therapy. I think we can take a couple of minutes now for questions for our first two speakers. And then we'll have a short break and then continue with the webinar. I see one question from Dr. Kurosawa for you, Dr. Moreno. Does the obstetrician often check for relaxin in blood tests? And does the value change the way you care for your patient? Relaxin is a protein in the bloodstream that's often a marker of how much the ligaments are relaxing within the body. And the levels of relaxin may be related to the increased flexibility in the pelvis. Have you done any research in this area or looked into this aspect?
Dr. Morino, so do you know about that? The hormone.
Unfortunately, I didn't. I don't know.
Mm.
Actually, I searched and I read many papers about like that because I wanted to know that also you, but I couldn't find that information.
Okay, I see. So
Yeah.
relaxin is very famous hormone.
Mhm.
When we research, when we see the sacral iliac joint problem in pregnancy, but in clinical settings, I never never examine that hormones in my clinical practice. So today we have Professor Britt Stooge from Norway. I imagine that in Norway, uh, there are many studies about this field. So how about this program, Professor Stooge, if you are here? No. Yes, Ben, please.
Yes, I think I can answer this question because there was quite a big study in Uppsala by Per Christiansson. He was mentioned as well in your speech, Saori. And he analyzed relaxin. And they couldn't find any difference in women with pain and those without pain. So actually, there's no need to do the testing. And most likely there are other reasons for the pain due to, for example, sensitivity in the receptors or such things. So because the level of relaxin was like the level of estrogen. So there's no difference in those with pain and with not pain. So he did it was a thesis for Per Christiansson. He was one of my school friends as well, so I know him personally. And after the thesis, the field is dead. So
thank you for your question, Daisuke. It's a really different question. As the evidence so far, we have a systematic review that looked into the studies on the relaxin, and first of all, it's a huge variation between the individuals in the level of relaxin, but we don't have any clear evidence of the association between relaxin and pelvic girdle pain problems. But from clinical perspective, we know that a lot of women, they understand that, oh, I'm pregnant, without any idea of that, but they can feel it on their body. So something seems to be clinically that the hormones, it might be more than relaxin, it might be a combination with other hormones as well, but it seems to be in many cases an association. But that's only a clinical evidence. We have no strong evidence from science.
Yeah, thank you very much for your expert opinion. Thank you so much.
I have a separate question for Dr. Moreno. It's great information about the prevalence of pain. What is your regimen for treatment? Do you have a specific pathway for treatment for these patients?
Yes, but the like a risk factor and the way of management is totally different. Where and when they they have pains. So the like assessment and the assessment is the first important, most important. Yes, I think so. And the and n- and we need to know what happened in the pregnancy and after pregnancy, and from that we can understand the risk factors or what happened for before the pain will occurs. And yeah, so because so many factor and management way they are.
Sure, sure.
Mm.
Understood. And then Dr. Kurosawa and Dr. Tanaka, for the bracing, very interesting bracing techniques. Can these braces be used in men with SI joint dysfunction also? I know our presentation today, our focus is on women, but can it be used in men also?
Using also okay, so the
Oh.
functional orthosis cannot be used in men. I tried to try to put it. It's very difficult. It's not
Understood.
comfortable. So it's very fit for women patients.
I understand. Okay. I think with that, we'll take a few minutes break,
Yes.
and we'll start in just a few minutes after this very short break. We'll start in approximately 3 to 4 minutes.